Good afternoon, Facebook friends. We are here live with Dr. Shaw and our beautiful patient, Michelle. Dr. Shaw is administering a venous freeze treatment on Michelle's abdomen. She's looking for a little bit of tightening and toning in addition to cellulite reduction. So thank you, Michelle, our beautiful patient, for being live with us today. I'll leave it in Dr. Shaw's hand and let him talk to you about venous freeze.
Hey everybody, thanks so much for joining us again for a wonderful Facebook Live here at Butology Southwest. And yeah, as Heather explained, what we're doing today is the venous freeze treatment. Venous freeze actually has been around for several years. It's gaining so much popularity because it is truly a great non-invasive way to go after fat and tighten the skin and go after cellulite all at once. Of course, traditionally liposuction is the best, most direct way to go after fat. Traditional liposuction in the OR, where my colleagues Dr. Dishar, Dr. Nojin, or Dr. Barnes would use ultrasonic catheter to go after the fat directly, take that fat out, and then tighten the skin. That's the best way to go after it directly. But if you don't have any downtime, you don't want to go under the knife, you don't want the little incisions, venous freeze is a great alternative. Venous freeze uses two different types of energy. It uses radio frequency energy and magnetic pulses. I do want to take a break and ask Michelle, how are we doing so far?
Feels great.
Are you
nice and warm.
Are you feeling the heat?
Feels good.
Okay, good. So we're using these two different energies to accomplish a bunch of different things. Radio frequency is actually an energy like radio waves or TV waves, very safe energy, and this energy is used to actually go after fat cells, and it's physically pushing a component out of the fat cell called triglycerides. And when we push that component out of the fat cell, we're actually shrinking down that fat cell. The other thing radio frequency is doing is it's waking up collagen production, stimulating healthy new collagen. So as that fat goes away, of course there's going to be some loose skin in its place. Well, the radio frequency is actually going to tighten up that skin, bring out some tighter, firmer skin to the surface. So we're getting two for the price of one. The last thing is that magnetic pulse energy that we're using. And magnets, as you know, have been used in wound healing and just overall health and wellness, where we're using the magnets here to also promote wound healing and collagen stimulation. So again, further increasing that tightening effect. Now we're going after Michelle's belly right now, and Michelle's in great shape, and she just wanted a little bit of extra tightening and firming and toning, and a little bit of fat reduction as well. And so this is going to kind of take Michelle to the next level. We're going after the front of the belly, the lower belly, and a little bit onto the sides as well. The laser can actually be used on any parts of the body. It can actually be used on the legs, the back of the legs, the thighs, the back, the bra roll area. We could actually use it under the chin as well. So lots of different areas. The great thing about it is it's very comfortable. Again, Michelle, if you could tell me what the pain feels like right now.
There's no pain. It's actually really warm. It's really relaxing, actually.
Yep. And so what we're going to do is we're trying to get to a therapeutic temperature, and I'm actually going to gauge Michelle's temperature right now. I'm going to get my little thermometer here. We're going to see where we're at. Okay, so we're about 40 degrees centigrade, and our target temperature is going to be right around 41 to 42 degrees. I'm going to go up just a little bit on the heat that I'm using. Okay, here we go. And so once we get to that therapeutic temperature, we know those two things are happening. We know those fat cells are shrinking, and we know the collagen is being stimulated. And so what we'll see in a few minutes also, Michelle's belly is going to get a little bit more flush, a little more red as we infuse those radio frequency waves down into the abdomen.
So Dr. Shaw, I know you mentioned earlier some alternatives to this particular treatment, but who's a good candidate for venous freeze?
So basically, for patients that they're not ready yet to go under the knife. If they're looking for a few inches in reduction around, again, the waist, the back, the legs, they're looking for a little bit of tightening, but they're not quite ready for surgery. This is a wonderful alternative. If you're good, now of course if you're looking for more of a dramatic difference, if we're looking for more than a couple inches in reduction, we're looking for a lot more skin tightening. Patients that have had large amounts of weight loss and that have a lot of excess skin, of course only surgery could get them those dramatic results. But For the rest of us, if you're looking for more tone tightening, maybe you've had a couple kids and there's a little bit of loose skin around the belly, or there's some cellulite that's developed as well after having kids. This is a wonderful, wonderful treatment to do.
Great. Now, Dr. Shaw, is there anything that Michelle can't do when she leaves us today? She forgot to mention she's here on her lunch break. So thanks for giving us your lunch break, Michelle.
No, she could, actually, that's a great thing about this laser is there's not really a lot of restrictions. Now, we are exposing the skin, to certain temperatures, and so the last thing we want to do is have her, expose it to higher temperatures right after the procedure. We don't want her sitting in a hot tub or taking a hot shower, maybe for a couple hours. But other than that, there's no restrictions. She could go about her daily routine. She could even go to the gym if she wants. It's not an issue.
So Dr. Shaw, you had mentioned that this can be used in multiple areas. Is there any other specific areas that are great for venous freeze?
Yeah, so the most common areas I see other than the abdomen is the thighs, the back of the thighs. We do a lot of the bra roll around the low back as well. We can show you some before and afters of results that we've gotten. The treatments themselves, they actually only take about 30 to 40 minutes, and you had mentioned when Michelle's on her lunch break, that's about as long as we need. It's just a lunch break to do a procedure. We have our patients come in for a series of treatments to get the maximum benefit, and usually the maximum benefit is at least an inch and a half, maybe even 2 inches in reduction in the area, the circumference that we're going after with the venous freeze treatment.
Good, good. Michelle, how you feeling over there?
It still feels really good.
As you can see, Facebook friends, we are getting a little bit of reaction there. Michelle's belly's getting just a smidge red, which is great. We love that reaction. It means we're getting a really nice thermal reaction to the skin.
We're up to 40 degrees, and so we're going to go up a little bit higher. We're going to get her to 41, 42, and we know we've kind of reached our mark, and we'll kind of cruise at that temperature for a little bit. Now, I mentioned this also works for cellulite. We actually have a wonderful treatment that works great for cellulite called endermology. Endermology works by actually breaking the fat bonds that cause cellulite. There's fat bonds that come about from hormonal changes throughout life, and those little fat bonds pull and tug on the skin and cause that dimpling effect. So endermology does a wonderful job to break those fat bonds and really kind of smooth the texture of the skin. Well, we could actually add venous freeze to endermology to give patients the biggest bang for the buck, because now not only are we breaking fat bonds down, but we're also killing fat cells and further stimulating healthy new collagen. So for patients that are really looking to get ready for whether it be swimsuit season or for that, for that next big event, and that cellulite's bothering them, they want to really kind of get rid of that as quick as possible. Combining endermology with venous freeze is a great option.
Good, good. All right, Facebook friends. Well, we're so glad you got to spend your afternoon watching venous freeze with our beautiful patient Michelle and Dr. Shaw. Dr. Shaw, anything else Facebook should know?
No, give us a call. Venous freeze is a wonderful technology. The actual lasers, we have a few of the lasers from Venus Concepts. The Venous Freeze is this multipolar radio frequency laser. Multipolar means multiple poles of radio frequency being shot into the skin simultaneously. Great for, again, reduction